I want to welcome you to this webinar on local implementation of the Marcus Alert legislation. My name is Katie Boyle. I'm the Director of Government Affairs at the Virginia Association of Counties, and I have HHR issues as part of my portfolio. I'm joined today by my colleague, Chris McDonald, who covers public safety, among other things. My colleague, Joe Lurch, who covers land use, economic development planning, many other issues, and our communications director, Gage Harder, who's driving the slides today. So on behalf of the team at VACO, welcome, and thank you all very, very much for being here. So as you know, the Marcus Alert is a major initiative with a lot of complexity and ambitious timeline for implementation. So we thought it would be helpful to our members to hear from two of the first cohort of CSB catchment areas to go live, as well as a locality that's in the second phase to implement. So our hope is that attendees can benefit by learning from their experiences as you're working on your own implementation plans. So Gage, if you could go to the next slide. So we are very, very pleased and very, very grateful to be joined today by an all-star list of speakers from Prince William County, Rappahannock-Rapidan Community Services, and Henrico County. And I know they're all extremely busy people, and they've been very generous with their time. So just wanted to start things off by really expressing our appreciation and our gratitude. Next slide, Gage, if you could. So just a couple of housekeeping measures. We are recording this webinar. We'll be posting a link to it on our website. We'll also make the slides and the recording available afterwards to everyone who registered, and you can feel free to share those. Since we have such a great turnout today and so many people on the webinar, I think it'd be easiest to put questions in the chat box and then we can pose them to our speakers. I think we'll hold questions until everyone's had a chance to speak, but you can type questions in as we go along. And just as usual, if you could stay on mute, that would help us eliminate background noise. And if you're on the phone and we're in the Q&A section, you can hit *6 on your phone to unmute. Okay, so next slide. Thank you, Gage. So before turning things over to the local representatives, just wanted to provide kind of a brief bit of background to reflect on sort of where we've been on this process and kind of bring us up to speed to talk about implementation. So as we're probably very well aware, the Marcus Alert system was enacted during the 2020 summer special session, stems from a very tragic situation in the city of Richmond, reflects a longstanding goal that I think is widely shared to ensure that a behavioral health crisis receives a response from the behavioral health system, and that when law enforcement must be the responders, that response is specialized and it's informed by an understanding of behavioral health. So the Marcus Alert legislation directed the production of a state implementation plan, which was developed by a stakeholder work group that met during the winter and the spring of this year. Several of our speakers and likely some of you on this call were part of that group. That plan was due July 1st, and it's available online sort of in its full form, as well as in a 20-page summary at the link provided here. So just to provide kind of an overview, and Gage, you could go to the next slide. This plan requires certain actions at the state and regional level, and then certain elements are required at the local level. So this graphic shows one of the major aspects of the plan, which is the framework for triaging calls for service based on urgency. So local programs, as you'll hear, have some flexibility to design their plans within this framework, but the overall structure is supposed to provide a common point of reference. So you have a scale of responses beginning with routine calls being fielded by the new crisis call center and the new 988 number, all the way up through moderate, urgent, and emergent calls where law enforcement or fire or EMS are being dispatched immediately. So the next slide. Okay, so this slide lists other aspects of implementation that are being developed at the state or the regional level. So you've got mobile crisis teams that are being funded through STEP Virginia and potentially also supported by some enhanced Medicaid rates. You've got the crisis call center. So our understanding is that the state is in the process of contracting for this platform, and that'll be connected to the new suicide prevention lifeline number, which is 988. And so that takes a few minutes to related to the crisis call center in 988. The state will be undertaking a public outreach campaign. So that's a state responsibility. And the intention there is to raise awareness about calling 988 in times of crisis. The establishment of training standards is also something that the state will be doing. The plan, to our understanding, is that it will be Department of Behavioral Health and Developmental Services and the Department of Criminal Justice Services collaborating for training standards for law enforcement, for the public safety answering point dispatch and telecommunicators, and the mobile crisis teams. And then equity at intercept zero is a reference to the sequential intercept model, which speaks to points of interaction with the criminal justice system where individuals can be diverted to more appropriate care. And this initiative seeks to ensure that there are adequate community services so that people don't get to the point of interaction with the criminal justice system at all. And so, Gage, if you could go to that next slide, thank you. This is just sets the stage here for what our presenters are going to talk about, which is the local plans. So the Marcus Alert legislation requires each locality to have a database that's made available to your 911 system and your Marcus Alert system, where individuals can supply information that may be helpful in responding to an emergency, sort of likely behavioral health sort of types of information. So then your local plan for full Marcus Alert implementation is due July 1st of next year. And these bullet points outline what's got to be included in that plan. So you'll have to spell out how you'll be transferring calls from 911 to the 988 regional call centers and how you're going to integrate that 4-level urgency triage framework. You'll have to specify how your local law enforcement will work with regional mobile crisis teams when they're serving as backup to those teams. And you also have to outline how local law enforcement will respond to behavioral health emergencies, so how your specialized response will be informed by training. And then you have to outline your plan for how you're going to ensure community coverage for crisis response, and so what your local processes will be at each level of that triage framework. And then if you could flip to the next slide. So this just gives you a sense of the timeline for the phased implementation as it was envisioned in the Marcus Alert bill. So you'll see that we've got 2 of our regions presenting today, and then Henrico County is in that next cohort of July 1st, 2023, and then you'll have sort of phased implementation for the next several years with the end goal of sort of full statewide coverage by July 1st, 2026. So, so now that we've kind of set the stage, I want to turn it over to our presenters who will be talking about their local planning process and how they're meeting these requirements. And so first to speak to you today is Heather Baxter, who's the program manager for emergency services in Prince William County. She manages operations for discharge planning, emergency services, co-responder, and the Crisis Assessment Center. She currently serves as co-chair of the VA-CSB Emergency Services Council, and she's the lead in Prince William County for the rollout of the Marcus Alert Initiative. She's a licensed professional counselor with experience managing inpatient psychiatric facilities and 24/7 response programs. She's a crisis intervention team trainer, and she serves an active role in training law enforcement within Greater Prince William County. So welcome to Ms. Baxter, and I will turn the mic over to you.
Thank you, Katie. So yes, we have a lot going on. We were required to submit as an implementing area our plans October 15th. While everybody else is due July next year, we were due about a week ago. So we have been working a lot. So you can go to the next slide. All right, so just jumping in on what we've done. I think the main thing to keep in mind about Marcus Alert is it does allow localities to do things that in a way that works best for them. They've given us instructions and a roadmap on how to do things. However, they also understand that every one of our localities is very different. Our resources are different. Our abilities are very different. Our funding is very different across our entire state. So we're able to really figure out what works best for our locality. So what we thought worked best in the beginning was we did need to create stakeholder groups. That was a requirement of the state. We decided to form two groups, an implementation group and a mission group. And what each of these groups had a different role. Our implementation group focused on protocols such as, the logistics. How is this going to happen? How do we roll that out? That's your people, like your police, your fire and rescue, your CSBs. We have magistrates and local hospitals that were on that team. That is the nuts and bolts of how are we supposed to make this work. The mission team is focused on the community voice and increasing awareness across our community. So we put out applications for that mission team within our community, received a lot of applications, and chose about, I think it was about 22, 23 people to serve on that committee. These are people who are leaders in the community that have connections to diverse groups within our community, because we want to be able to get feedback from them on things that the community would like to see as far as crisis response, but also be able to find ways to get information about Marcus Alert out to those communities. So that's the focus of the mission team. And so we felt it was important to have two different groups there, because we feel like there was two different missions, getting the protocols set, but also making sure the community was a part of this and had a voice in what was going on. So those groups started meeting in May. So from May until now, we have met on a monthly to bi-monthly basis with the mission group. For the implementation team, we've been meeting about every 2 weeks. That has been something that we have had to put a lot of work into, and we have amazing relationships with our police departments, so that has made that a lot easier. A lot of good participation from them. This is a heavy lift. This is not something that you can just, say, oh, sure, we'll do that. There's a lot to this. There's going through policies and procedures of the police departments, going through all these protocols. There's a lot of details, and there are changes to functionality of how we respond, how our Psaps answer calls, how our law enforcement respond. There's a lot. So every 2 weeks, was absolutely necessary for us to meet from May all the way until now, and we continue to meet even after our plan has been submitted. So with our plan, we had to define for the state, we had to say how we were going to address the protocols that the state laid out for Marcus Alert. The first protocol is about Psaps. So this is our 911 communications and how they would answer calls, who they would dispatch, and also when we would triage those calls. So Marcus Alert put out the 4 levels that Katie talked about earlier. And we had to say, if it's a level 1, here's what we will do with that. Here's how we will respond. Here's where we'll send it. Here's who will be dispatched. So that whole protocol 1, this slide says we're working on updating our CAD systems. That is a huge lift for anyone who is in law enforcement or Psaps that understand CAD systems. This is not easy. We have to have a lot of technical people involved in this. So we need to collect data. We need to be able to show that our Psaps are tracking what type of call it was when it came in. Was it a 1, 2, 3, or 4? What they did with it. And then also when law enforcement clears that call, what was the final disposition in that? So all of that is updates that have to be made to our CAD systems. And we are in full force working on making that happen. And then how they transfer the calls. So when the call centers are up and running, the level 1s and 2s are meant to be transferred over to the call center. And so we had to put into place what are our protocols and procedures for making those transfers happen. And we chose to use the what we kind of call the poison control model, which is, I think, what most are choosing to do. And that's to do a warm handoff. 911 stays on the phone. They call the call center, 988. And they stay on the line until the call center has established that 911 is no longer needed. A reason that they might still be needed is if this elevates, if it goes from a 1 or 2 and starts to elevate to a 3 or 4, where maybe dispatch does need to send police out, that would be a reason that 911 might need to stay on the phone. But once the call center establishes we don't need police, then 911 can back out of that call and leave that to the call center to manage. So we had to really put into place what all our procedures were to make that happen. Protocol 2 is an MOU that we have to state how these relationships will work. When the call center is up and running, how will our regional response work? How will our police respond? Our local behavioral health response? We have to say how all that's going to work. We do have a year, thank goodness, because MOUs are not quick things. Our regional director for the CSBs is for Northern Virginia has taken on the task of putting that MOU together. We are going to do an MOU specifically for Prince William with the call center, with our law enforcement, with our Psaps, with our regional response teams. And we say that because then Fairfax, when it rolls out, will have their own MOU with all of those people involved as well on their end. So we are keeping our county MOUs separate, but they are all with that regional call hub. And we have a year, thank goodness, because it's got to go through attorneys and lots of people. That is something that you really want to have working because it's going to take a while. Getting anyone who's dealt with MOUs knows that is not an easy process, especially when you have that many people on an MOU. Protocol 3. This is law enforcement specific. This is what law enforcement need to do, and I can't express this enough as advice to people, is make sure your law enforcement reads this piece front to back when it comes to Protocol 3. This is the stuff that law enforcement has. There's kind of a checklist on them saying, yes, we do this, or yes, we will do this. They look at the trainings that they currently provide and make sure that they meet the criteria of Marcus Alert. Look at their policies, their general orders, make sure their use of force policies are in line with Marcus Alert, the no force first. Luckily, ours were already in line with that, so there wasn't a lot that we had to change, but there are definitely things within our general orders that our police department has that we would like to update just to make sure that we are focusing on the different areas of behavioral health that could be addressed. Trainings within the academies, there's significant change if the academy is not already doing some of this stuff. There are changes in there. This goes to all different levels. And then also recommendations for CIT trained officers. We already exceed all of the requirements of Marcus Alert for CIT trained officers. So that was not a problem for us, but that is not the case for everybody. So making sure that you have CIT trained officers that can respond, making sure that you have the trainings that are being required out of Marcus Alert in your academies, and making sure that your police are on board with this. That Protocol 3 is so important to have law enforcement engagement. Without them, this would be a very difficult thing to do. You can go to the next slide. This just shows, back up one slide. There you go. This shows our community coverage of what it looks like for Prince William County. We already had a co-responder team that was locally funded. We were very lucky that our Board of County Supervisors did that. We have 3 teams that were funded in 2020, and then we have 3 more teams that will be starting in January. We'll have 6 total co-responder teams with a clinician and an officer. That is something we already had in place. We have our emergency services team, which every CSB has. We have our regional crisis response, which is in our area is CR2 and REACH. They are already existing. The state has funded them to bolster up more. So I was just in a meeting where they are going to have 34 teams, I think, across our region and be spread out across the region to respond on a regional basis. And then with our Marcus Alert monies that we received $600,000. Part of that has to be used for a Marcus Alert regional coordinator. We decided as the implementation group and as the mission group that the best use of those funds was to create a team that would close the gap on what we felt was the gap in Prince William County. And that is where you have 2 types of people that need services. You have those that are constantly cycling. They're going in and getting screened at the hospitals. They're engaging with police on a regular basis, and they're not following up with services in the community. We want this team to be able to do follow-up and reach out to them. There is the other group of people that don't get to the point that they need hospitalization, but they're still in crisis, but they're not receiving services. And those people they often are not reaching out, and we want this team to be able to reach those folks. These may be your high utilizers of 911. Maybe they're calling a lot, but it doesn't rise to the level of needing police. We wanted this engagement team to be able to respond to level 1s and 2s and do follow-up. So fire and rescue and police will be able to send outreach requests to this team for non-emergent outreach requests, where they just, maybe they went on a call and they felt like, this isn't someone for me to take in, but I feel like they need connected to something. And police and fire and rescue know what I mean when I say that. It's just that feeling of this person just needs something. This is a team that they can make that outreach request to. This team will follow up and try to meet those needs. You can go to the next slide. So the lessons that we learned, strong relationship with law enforcement is the most helpful piece of this for quick collaboration. If you're spending a lot of time trying to build that relationship now, it is going to slow down your ability to move forward. It's not gonna, you can still get there, but I probably say that to law enforcement the most is, man, they gotta trust the CSBs and we've gotta be partners in this, including all involved agencies in the planning. Our group from the get-go involved fire and rescue, police, magistrates, local hospitals, and ourselves. So we wanted to make sure everyone that was going to be involved in this would be involved. The reason fire and rescue is involved is because we are going to look to them to respond in lieu of police when possible. So our hierarchy of response is going to be behavioral health if we can. If behavioral health isn't there, we want our fire and rescue, which would be your EMTs, to try to respond. And then if they're not available, then police. We want to be able to put police as the last response, because they're absolutely necessary, because no one else can, or it's at the level that police need to be there. But getting all of them involved from the beginning is very important. Ensuring community representation, I can't express how valuable it is to have those community members that know the community. I know mental health. These folks know the community. They know the things that are needed out there. They can give you the information that you're missing on how to reach the community. Develop community awareness and media strategies. This information's got to get out. We can provide it all day long, but if the community doesn't know that it's there, then it's kind of pointless. We need to make sure they know. We did a survey in the beginning, and we found out very quickly through our survey that our community has no idea what crisis services we provide. And really, even the ones that have accessed it still don't quite know what's provided. So this is an opportunity to get out there and educate, and not only let them know what we provide, but also hear from them what we need to be providing. And developing data collection and tracking, that's going to be a hard thing. The CAD system, as I mentioned before, that's going to be difficult, and that takes a lot of communication with your Psap and whoever's leading their IT for their CAD systems. And if you have your own mobile teams that are responding at a local level, you're also going to have to develop your ways of collecting your data for each of those calls and tracking that. That's a heavy lift and needs to be discussed from the beginning to make sure everyone is on the same page with that. So, Katie, that was the end of my information. And I'm not sure if you want to move on to the next one or if there are questions.
Well, thank you so very, very much. That was really extremely helpful. I think what we'll do is let the other folks talk a little bit and then maybe have some discussion. And I think panelists, I think attendees may have questions for all of you. So thank you very, very much. So now to provide a perspective from a multi-locality CSB that serves rural areas, I'd like to welcome Jim LeGraff and Erica Vesley. Mr. LeGraff has served as the Executive Director of the Rappahannock-Rapidan Community Services since 2018. He has a long professional history in human services organizations supporting individuals with intellectual and behavioral health disabilities. He's participated in many statewide initiatives, including representing the health planning region on the Department of Behavioral Health and Disability Services STEP Virginia Advisory Committee. Ms. Vesley is the Community Response Coordinator at Rappahannock-Rapidan Community Services. And so I welcome to both of you, and the floor is yours.
All right, thank you very much. You can flip over the slide for us. Thanks. Just a little bit of background, because we are quite a bit different from Prince William County regarding our organization. You know, RRCS We are a 5-county community service board supporting Culpeper, Fauquier, Orange, Madison, and Rappahannock County. And within our 5 counties, we support 9 different law enforcement jurisdictions. And I think that's really important as Erica talks about some of the implementation challenges that we as a community service board have faced. And while we're, a lot of people I think sometimes consider us Northern Virginia, especially maybe our Fauquier County, we do predominantly retain a largely rural composition. In this area, I think one of the reasons too that is we were very interested in starting this initially is because we have been running a small co-responder program within our couple counties, largely funded by local foundation as a pilot, and have really seen some of the value of behavioral health and law enforcement working together on these concerns and issues. Next. Okay. And I think similar to what Heather was talking about as far as our planning process, the most important aspect for us as we were starting our planning was really getting buy-in. And to do that, we went to all of our 5 county boards of supervisors. We talked to our county administrators and our heads of local law enforcement to get support for us to be an early implementer. And all of our counties passed letters and votes of support. We received lots of letters in support of us for the project. And from there, we used that to develop our local planning team. And to kind of piggyback on what you heard on earlier, our local planning team has very broad representation. And you can see on the next slide, and I guess you can't see because it is a little small, but the members of our team really consisted of, we have one planning team, but we have a member from every one of our law enforcement jurisdictions. We have a Commonwealth attorney. We have members of local Psaps. We have community advocates, the NAACP, other community leaders. And I'll be honest, I believe this has been, for us, one of the strongest points of the Marcus legislation is within our 5 counties. I believe this is the first time we've had such a diverse group of individuals representing both law enforcement, emergency services, the criminal justice system, community advocates. We have members of the clergy, all talking together every 2 weeks on what we believe is a very important problem that needs solving in our community. And having these individuals on this planning team work through the problems and the challenges that the legislation has put forward has really allowed different groups. It's allowed law enforcement to really work closely with advocates or private providers and clergy members and so on and so forth. And just to see different points of views, how the system is being perceived, and hearing how mutually these groups have come together to work out some of their goals of the process has been really pretty terrific. Thank you. Next one. Okay.
So going off of what Jim just said about our planning team, I'm going to talk about some of our local requirements. I'm going to try and not reiterate because Heather did a really great job of kind of summing those up. So I'll focus on important differences for our community. The voluntary database and how we are doing that is different, I think, than most of the other implementation sites. Our planning team determined that the voluntary database really should be developed and administered by our CSB. The community advocates that were on our planning group, advised that it would likely be a lot greater participation if the information that community members shared was housed with the CSB rather than a law enforcement entity. And so we're creating that database. So we've got a cobbled together one now, and a website is being developed. And then our Psaps will log in to grab that information from that database. So that's something that really came directly out of that collaboration of the planning team. And then you heard Heather kind of speak about all of these different local requirements. And so I'm going to flip to the next slide to kind of, this was something that our Psaps really latched onto. It was what was easy for them to think through. And so using that leveling system to think through the responses. And again, this was given to us in the state's toolkit, as it were. And so you all will receive it as well. So our Psaps really developed this using all of the information collected through our community members and our emergency services to think through the resources that we had available for each one of these levels. And they had a lot of law enforcement input as law enforcement thought about, okay, you know, how are we going to meet these areas and these measures? And so again, we are limited because we do not have our crisis call center. It doesn't exist yet, so we've been limited in our ability to create those MOUs. And we also, in our area, we only have it's 5 days a week for 8 hours. Do we have access to child mobile crisis? We don't even yet have access to adult mobile crisis. So that's one of the challenges that we're having is, you know, our folks creating protocols with services that aren't yet in existence. So we can move on to the next slide. And that's you, Jim.
Sorry. Okay. So I was trying to respond to one of the chat questions. Sorry. As far as the integration with the co-responder and other services, you know, I think as Erica alluded to, you know, the counties that we support have varying levels of needs related to crisis due to their population size. You know, for example, Rappahannock County as an entire county is 7,200 residents. And so we really wanted to be able to use and support a couple of our very rural counties that have low level crisis calls from a volume perspective. They might only get, you know, 1 or 2 a week from a crisis call, which really then makes it very difficult for that county to fund a co-responder model. And so one of the things that we developed was a drop-in center that would allow law enforcement to bring individuals outside of the ECO TDO process. One of our challenges too is that while we have 2 community hospitals, neither of our community hospitals have any acute behavioral health beds, nor in our 5-county region do we have crisis stabilization unit. So as we were looking at this you know, kind of integration question, what we could do, you know, volume and capacity really became critical issues. And so the gap between a hospital placement or being released was something that we looked to fill. Additionally, we are adding, like I said, we do have a small co-responder model that's predominantly works in Fauquier and Culpeper, our 2 most populous counties. We have added additional co-response positions that while they're being stationed, they are embedded in local law enforcement, but they, particularly in Fauquier, do not ride in the car. They meet law enforcement at the scene. And so we will actually have some more flexibility now that they would be able to, based on availability, that if Madison or Orange or one of our other smaller counties is having a crisis and that person is available, and it makes timely sense. You know, we're a large geographic area. It could take a couple hours to get from one end of our region to the other. And so obviously law enforcement isn't going to wait for that amount of time for a responder to be available. And so the establishment of a central based recovery center where as long as a person was not in a crisis where they were a threat to themselves or others, we have another resource in our community that law enforcement could use. While it's peer run, it does have 24/7 clinical based supports wrapping around that. and again allows just that handoff of people, and so on and so forth. Next. Again, the funding, like all the implementation sites, we received about $600,000 from the Department of Behavioral Health. And as I said, we really use that money to focus on expansion of some of our peer programs for the Recovery Center, which we thought gave us the most coverage over the largest geographic area. We are using some qualified mental health professionals in the co-responder model, an additional clinician, a licensed person in the co-responder model, and you just see some of the other costs, marketing and those types of soft costs.
So next steps that we'll be working on, we are building public awareness of our voluntary database. And so we have a subcommittee from our larger planning committee that's working on that. They've developed some paper literature, and now they're getting out into the community to, you know, build awareness of the database, as well as you know, some of our pre-crisis resources, including that peer recovery center that Jim was discussing. And then once our crisis call center stood up, we will be, you know, developing a lot more specificity in our protocols, and same for with mobile crisis services. And then again, expanding that co-response program as is necessary. And our law enforcement continues to keep building their CIT trained officers. So those are our next steps. You can move on. Thank you. So challenges, one of our biggest challenges has been trying to develop protocols with lack of infrastructure. So, you know, imagining how the protocols will look once we have those entities has been a challenge for very, you know, good reason. You know, protocols need to be very specific when safety is on the line. And so that's been a challenge for our law enforcement and Psap folks. And also too, there's been a lot of training that's discussed that will be needed, and but all of that is not yet completely defined. So it's been challenging for our law enforcement and our Psaps to, you know, commit to levels of training when they don't know what that hours means, because it's a manpower issue. You know, these are small agencies, and so when you have folks out at training and you have to also cover your shifts, it becomes a manpower issue. So, and lessons learned, Marcus Alert needs champions. And so we had amazing champions of Marcus Alert in our Psap community and in our law enforcement community, and we wouldn't go anywhere without those champions. Heather had mentioned that in hers as well, and I think building those relationships now is very, very important. Coordination. So we, you know, making sure you have inclusivity in the planning team. Jim already spoke to that. We then really identified tasks that needed to happen, and divided those out into different subcommittees, and having regular recurring meetings. The planning team meets every 2 weeks. With agendas, and then those subcommittees have deadlines. Some of the subcommittees are meeting weekly in addition to those every 2 weeks. And again, champions, you got to have champions. And with our 5-county region, you really needed to have champions in each jurisdiction in each county. So. And again, Jim already kind of spoke to some of these rural challenges, but just, you know, resources. We have resources across our 5 counties, but accessibility to those resources varies across the 5 counties. And so, you know, the volume of need again versus the distance from those resources. Our manpower, turnover was something that we discussed a lot, because our our law enforcement agencies, all of them are really committed to having CIT trained officers. However, then there's been some turnover, and so you lose that training and you have to redo that training. And you know, we talk a lot about rural challenges, but I also would like to state something that's really important in the rural communities is that law enforcement and the CSB folks really know their community well and their citizens well. And so they know a lot of the members of the community who are struggling with mental health, and they're well known to them. And so that's one of the things that's a real positive in the rural communities, and that will be helpful in the plan making. Thanks.
Well, thank you both very much, and I know we will have some questions for you, and you've given us a lot of great food for thought. So thank you both very, very much. So I will turn things over now to Chief Tony McDowell, who's the Deputy County Manager for Public Safety in Henrico County. He works with and coordinates the tasks of the police and fire departments and assists the division's chiefs with special projects. He also represents Henrico County on a range of task forces related to local, state, national, and international public safety. He's also a member of VACO's Health and Human Resources Steering Committee. So I want to welcome Chief McDowell. I'm going to turn the mic over to you. I know you have a team of folks who are here to help with your presentation, and so I'll turn the mic over to you so you can introduce your team who'll be speaking today, and thank you.
Sure, thanks, Katie. So listen, we brought the whole team on the call because unlike the jurisdictions that have already put together a plan, we're still in that forming, storming phase. The good thing, or maybe the bad thing, is that Henrico had been putting quite a few plans and processes and protocols into place going back to the early 2000s to try to improve how we respond to people in crisis in the community and build the collaboration between agencies. And so there were a lot of things that we were already working on prior to the Marcus Alert legislation passing. And so in some ways that's positioned us well. In other ways, it's been a challenge because what we've been working on is maybe slightly different from what the law requires. And so we've had to really look at how we can capture the progress that we've made so far and then build upon it in a way that meets the intent of the Marcus Alert. And so I don't know if we're going to come to the webinar today with all of the answers, but I think that we're probably in a situation like a lot of the other folks on this call where we're trying to grapple what we've already done, where we've had some success, and then how we continue that forward under the Marcus Alert framework, where we still have a lot of questions that we feel like we don't have answers for about things like some of the technical parts of this call center. When's it going to open up? What's the technical piece going to look like? How much funding might be available? You know, even to the point of understanding specifically what's required from the local planning effort. And so to kick us off on that, I've asked Daniel Rigsby from our Community Services Board if he would kind of give the group a little bit of an overview of where Henrico has been on this subject and where we are right now. And then we have several subject matter experts that can jump in on issues ranging from the law enforcement perspective, our STAR team, which is part of a CIT, it's like an evolution of CIT in our county, as well as with our emergency medical services. So Daniel, if you don't mind kind of taking it from there, that'd be great.
Sure, thank you. Good afternoon. It's really helpful hearing from the other boards because we have some similarities as well as some differences. We also serve 3 counties in the Central Virginia region: Henrico, Charles City, and New Kent. And Henrico really recognizing the significant transformation of services that the Marcus Alert involves, really proactively formed a group of people to serve sort of as a task force leading the efforts to move towards implementation of Marcus Alert. So that task force is comprised of fire, mental health, and police communications. And their CIT lead officer is part of that team as well. So that's really been a place for us to start digesting the information as it's come out, to look through the recommendations and try to start thinking about what interpretation will look like. It's been somewhat challenging because some of the information that was shared with the original 5 CSBs has been slow to roll out to the second wave of CSBs. So it's sort of a process of trying not to get ahead of the process too much, but also just recognizing how much change it's going to involve is trying to make sure that we're prepared as much as we can be. One of the things, as Tony mentioned, is what we've tried to do is to look at what are our existing structures in place that we can build on to move towards implementation of the Marcus Alert. And there are really 2 programs kind of similar to what Prince William mentioned that really work with outreach and engagement. One of those is our care teams affiliated with our EMS fire services, and then also our STAR team, which is affiliated with our police services. And I thought it would be helpful a little bit for Lieutenant Wood to talk about the STAR team, what it does currently, and then how we can build on that as we move towards Marcus Alert.
So our STAR team, Services to Aid Recovery, is we meet weekly, and it's a group of officers and mental health clinicians and fire personnel in schools, building inspections, social services. We all meet and decide who might need some additional follow-up services in the community. We've identified those people that are in need, those people that need that extra follow-up. So we're already out in the community seeing people, and we're tied in with our assessment site as well. So that it really works out in terms of a prevention angle. We're in the community. We know when people are starting to have some problems or might need that extra care, and then we can go assessment site or go to mental health or whatever agency that might be able to provide services to help that person at that time. Our relationships, both internally, we have a great relationship with mental health and fire and other agencies, to where we all work together to serve that person in the community, that give them the best resources and serve them, immediately, and what they need long term as well. It really works out really well with us. We plan on building on our STAR team with the care team as well, and plan on building on that model.
Thanks, Cindy. Struggling with my mute button. Monty, do you want to mention about the care team as well?
Hey guys, this is Jaleesa
I'm sorry,
with
Jaleesa.
our Community Assistance Resources and Education Program. Are you guys hearing an echo? Okay, hold on 1 second, sorry. Can you hear me okay? Good, perfect. So our Community Assistance Resources and Education Program is housed within our EMS for fire and EMS with Henrico County. And what we do really is we go a little bit beyond the 911 acuity calls. So as Cindy said, along with police, mental health, social services, or building inspections, our goal is to loop back around to our county members or our county residents and make sure that they have all the resources and supports that they need. And so right now the focus has been on a lot of those more medical things, but we do involve that, or we are involved with some of those folks who have SUDS or the mental health disorders or our older population. And so building upon what we're already doing with care and adding that extra layer of Marcus Alert onto it, we are hoping that it's going to be like a full all-encompassing kind of co-response team format to make sure that we are providing our folks with the services they need wherever they are within the community.
Thanks, Jaleesa. So we're really hoping to use some of these foundations to build the structure of the Marcus Alert on. Some of the challenges that we're already experiencing is really related to how different aspects of Marcus Alert are being rolled out. So Marcus Alert is a phased implementation, but I think Katie mentioned earlier, there are also some changes to Medicaid that are occurring to support Marcus Alert implementation, but those go into effect December 1st of this year. So we're trying to figure out how to position our emergency services in such a way that they will be prepared to support Marcus Alert, and also to adapt to the new Medicaid regulations that are coming into effect. And then there's the whole issue of the 988 rollout that won't be happening until next year as well, and trying to understand, as someone mentioned, how to be planning around a system that doesn't yet exist. So if anyone else on the team, if there's anything you feel like I've left out, please feel free to jump in, but I think those are kind of the highlights from Henrico.
Hey, this is Tony. I just wanted to throw out there a couple of points that I don't want to miss. One is that our police division was pretty proactive with CIT training, and 100% of our police officers are fully CIT trained, and we actually put our fire and EMS folks through it as well. It's not mandatory, but I would say probably 40% of our fire department uniformed has been through the full 40-hour week, and the vast majority of our medics. And so that's been going on here since the mid-2000s. And so none of that's new for us. One of the things that has required a change in our thought process, we've really tried to approach behavioral health crisis from a prevention standpoint. Marcus Alert is all about the reaction to it. It's not unusual for a community the size of Henrico, and I'm sure Prince William can identify with this as well, is it's not unusual for us to have 4 or 5 or 8 or 9 crisis-related, mental health-related type calls occurring simultaneously. And so while we've seen some great expansion through STEP Virginia, through the REACH and the CREST program, and we understand that the hub, once it's up and running, will provide some additional regional resources. That's a large geographical region with a relatively small number of new behavioral health resources, these mobile crisis teams, when the reality is that we might have a suicidal subject and a barricaded subject and a person who just needs to talk and somebody that's standing in traffic yelling at cars, all these things happening all at the same time simultaneously. And it has been a struggle for us to wrap our mindset around how do we handle all of that in the way Marcus Alert intended for it to be handled without dropping any important balls in the process. And so we're pretty optimistic of seeing how the first 5 jurisdictions pull these plans together, and we're hoping to, quite honestly, learn from them, and then whether we're up next year or the following year, we hope to add to that body of knowledge going forward. And Katie, unless anybody else from Henrico wants to jump in, I think that's what we have for you.
Wonderful. Well, thank you very, very much. And thanks to all of your team members for being here. So I think we've gotten a couple of questions in the chat. And so I'd like to kind of open that to panelists here. And I'm going to start with a question that's some folks have weighed in on in the chat, but just wanted to kind of give people an opportunity to elaborate on a little bit more. So this is from Keith Johnson, and he's asking about funding for the voluntary 911 mental health databases. And so I think had a couple of responses, but I'd like to just open it up to the panelists to talk about kind of how you've made that work and anything else you might want to add to that question.
For Prince William County, well, just overall, no, there is no funding. That's the straight answer is there's no funding for these voluntary databases. They have left it up to each locality to determine how they do this. For Prince William, we already had Smart 911. That does cost per console. Our Manassas Park City decided to adopt that as well. It's very easy online, smart911.com. You can put your information in. It's a great thing. It's based off of your cell phone or any phone number that you put into the system. It is based off of. Manassas City chose to use a free application called Rapid SOS. Understandably why you would want to use a free one. The only downfalls to that, it is online, but the only downfall to that is that it's based off of address and not off of phone number. So that causes a bit of a problem. People are calling. But that is what has happened in Prince William County.
Yeah, I think, you know, for our implementation team, the voluntary database was something that we struggled a lot with. And some of the real concerns and challenges, you know, we looked at the Smart 911 system because we did have some jurisdictions that were already engaged with Smart 911. But as Heather said, Smart 911 is tied to a phone number. And so it, you know, the concern was that, you know, if you registered yourself and during the height of a crisis, would you be the one probably calling 911 for that information to be shared? And so our team thought that there was a lot of challenges with that, or with the smart or with the rapid SOS, because it's tied to an address. Again, similar challenges, especially if people in our area, our Psaps don't necessarily talk to each other. And so the ability to have something that would be a little more flexible to be used by multiple jurisdictions across jurisdiction lines. And again, it's new for us. I have no idea how effective this solution will be. I think I'll editorialize a little bit. I think, you know, some of the components that I hope will change over time with Marcus Alert is we really should have a state database that is available for this type of a project. It is kind of ridiculous that we have local jurisdictions trying to manage because people move across the state. So that's just a personal little editorial, but I think there are just significant challenges written into the legislation that hopefully over the next couple of years with some advocacy, we will be able to get this changed.
Hi, this is Keith Johnson. If I could just add maybe a couple or ask a couple of follow-up questions. So my reason for asking, I'm the local fire chief here and operate the Psap in Loudoun County. I'm also the president of the Virginia Fire Chiefs Association, so I represent a much larger organization throughout the Commonwealth. And we in Loudoun also went live, made our deadline of July 1st with using Rapid SOS, and that does work off a cell phone number. With that, and but obviously there are jurisdictions don't have either Rapid SOS or some of these programs that they have. So there is an implementation cost for that, even though the program may be free. They certainly have to you know, get that indicated and get that configured to their local CAD system and get that up and running. So nothing's free in this world. I think we all know that. That there is a charge for this. So when we look at this being an unfunded mandate to our local Psaps, that's exactly what it is. So that my question was there funding? Because I've been asked that question a lot from around the state, from local fire chiefs or even operators of Psaps, you know, whether there is funding for that with that. And I agree, Jim, you hit the nail on the head. If you have Rapid SOS and it follows your cell phone, it doesn't matter whether you're in Texas or California. As long as you use your cell phone, it'll follow you. But that's dependent on Rapid SOS. If you use another program, it doesn't follow you. So you're exactly right. I think there, you know, in order to be effective, you would need certainly if you want to get it to travel around the state and follow you to be effective, you would need a statewide program, or at least to have the state adopt a standardized statewide program to be able to follow that caller. Because once you leave, if you register in Loudoun County, once you leave Loudoun and go to another jurisdiction that doesn't use Rapid SOS, you're kind of out of luck. So good answer about the funding. We will probably look to pursue, you know, some type of funding for local Psaps through the Commonwealth, because I think that's important for especially smaller jurisdictions than many of us on this phone call to try and implement. Thank you.
All right, thank you. Let me see if I can fit a couple other questions in here. This is from Christopher Cross. Are fire and EMS partners in your localities amenable to responding to an incident, level 1 or 2, without law enforcement securing the scene? Do any of your Psap partners have specific plans established on how they will determine the level in conjunction with their EMD protocols?
Yes, I actually was just on a phone call about these EMD protocols earlier. For Prince William, first part, our fire and rescue is very amenable. Because a level 1 and 2 is saying that there is no risk and that this person is voluntarily willing to have someone come out, yes, our fire and rescue is willing to do that without police securing the scene. If you're a 3 or 4, that already requires that police are securing the scene. So that we have gone out and done trainings with them. They are aware of the levels and what all of that means. The Psap partners that I talked to today, we are going to be putting in a lot like those EMD protocols. We are going to be making cards for how it's going to work for triaging these level calls for when they come into the Psaps. From what I am told, and this is just from me listening to Psaps, and other people may have much better understanding of these, is that they will continue to follow their EMD protocols. That will not change. The call type itself will not change. If there's a Marcus Alert piece to that, then they will also utilize the protocols for who to dispatch with the triage for Marcus Alert.
Katie, this is Tony McDowell. Can I add one piece on the call screening? So like a lot of localities, Henrico uses a software system that we subscribe to. It's a licensed system called Priority Dispatch. And they essentially validate all of the emergency medical dispatch questions to make sure that the way we're asking the questions and the way we're drilling down on what the person needs is validated by the American College of Emergency Physicians. And it's very specific on time frames. So our goal is from when the dispatcher picks up the call, when they pick up the call to when they dispatch the units is supposed to be no more than 60 seconds, 90% of the time. So there's a real concern about adding in some additional steps in that process of trying to evaluate whether something is a life-threatening medical emergency versus a behavioral health emergency that can be transferred to 988 when the software system that we use to manage that call doesn't provide that currently. And so we're working with Priority Dispatch. I know other localities in Virginia have had the same conversation with them to talk about how that system can be updated in order to allow us to basically take an exit, an off-ramp from the Priority Dispatch interstate that would allow us to do the type of screening that the Marcus Alert requires. But it's one of those issues that we can't totally control on our own because of the proprietary nature of the system that we're using and the way that it's tied in. I mean, it's tied in with our fire department's accreditation, with the way our medical director wants medical calls handled, and with the way we train our dispatchers. There's just a lot of moving parts to it. And I think that's a piece that's a little bit more complicated than maybe the timeline that was envisioned for Marcus Alert took into account.
I would agree. I think we have seen a very similar challenge, with our county dispatches that we're working with is, those protocols give you, I think, an appropriate response, but also a high level of protection. And so I think we've also heard that if in the Psap response is not wanting to divert from those protocols in any way, shape, or form, because if something happens, and they've diverted from their established protocols, are they opening themselves up for different types of risk? So.
Thank you. And kind of I think this is a good segue to a question about sort of potentially an iterative process here. So Sue Rowland asks, how are your lessons learned being communicated to state leadership in and outside of the administration?
We have a monthly meeting where all 5 of the implementing areas meet with the state leadership, which includes DVHDS and DCJS, where we express our concerns, which we had one yesterday, and I can tell you the discussion is lively. We do not hold back. We express all of our concerns. Anyone who's in there was in that meeting yesterday knows that. And they have heard, and they are working with us. Part of being an implementing area is that they are allowing us to come back and say this isn't possible, and listening to us say this isn't possible, so that when it does come out to the rest of the state, that maybe some of those kinks are worked out. But we do have a monthly meeting with them. We also have a every 2-week meeting that occurs with state leadership with DBHDS and DCJS that is for regional coordinators for Marcus Alert to be able to express what's happening as far as call centers and other information that's occurring.
Thank you. So another question here. Any idea when DCJS and or DBHDS is going to release training standards and protocols for law enforcement officers?
Nope. We would like to know that answer as well.
Yeah. Yeah, looks like no one else is jumping in, so I'll throw the next question to you. This is from Supervisor Baumke from Stafford County. Has anyone discussed additional staffing requirements for Psap staff as a result of the Marcus Alert legislation?
No, not in our area, at least that has not been a concern. There was a concern put out, I will put that we identified in our plan as a barrier, is when we have 3 different Psaps, and one of our Psaps only has 1 call taker. Another one of our Psaps, is huge, but one of ours is for our park, and it has 1 call taker. And they did put out that a barrier is you cannot do a warm handoff when your phones are ringing and you're the only one that can answer it. So that's not just a Marcus Alert issue, that's an issue with any warm handoffs that they do, but that is definitely a concern.
We've had some conversation in Henrico about if there's a good public relations campaign that rolls out with 988, then the hope is that many of those calls won't go to 911. They'll go straight to 988 in the first place. And in some ways that could actually be a benefit to the 911 centers as far as volume. And I think the more urban localities are typically struggling with turnover. And so, we could add more authorized positions, but if we can't fill the vacancies we have now, it doesn't help to add additional positions. And so I think that there's certainly an appetite here. And once we know what this is going to look like and we understand the scope of practice of the call centers a little better, and we know how the technology, the 10-digit dialing and the 988, there's a lot of things that are supposed to come together in less than a year. We look forward to getting that information pushed out to the community and hopefully get those calls going the right direction from the very beginning.
I agree with Tony that has really been what our Psaps have responded to, is their belief that this will decrease the amount of calls and the time that they stay on calls for those people that are really just looking for someone to talk to. They can now divert that to where they need to go, and 911 can focus on dispatching appropriate calls.
So I think we've covered all the questions in the chat. I just want to give folks on the phone an opportunity to unmute if they have questions. So you would do *6 on your phone to unmute. Well, I think everyone's just maybe digesting all the good information that you all have presented today. So, so we will be sending out the slides and a recording of this session. And I just really want to reiterate our appreciation and gratitude to our speakers for being willing to share their experiences and their lessons learned. Really informative, really helpful. So our sincere thanks on behalf of VACO to each of our presenters, and just want to thank you all and wish everyone a great rest of the day. So thanks so much.